I'd like to address some of the tough choices. I do think that what's going on now is significant and will have a significant impact on many people, but certainly not people in the large employer market. But for people who are in small group market or individual market, this is going to have major implications. And we should not diminish the benefit that we're about to enact for them. I see this as a first step. It's certainly going to require more after we get legislation enacted. Those of us who are in health policy will have lifetime guaranteed jobs because this is not perfect, and there's going to be a lot of challenges around implementation. Let me identify those 3 issues that I think are going to be very tough in the next few weeks. The first and most important in some ways is financing. The bills are not adequately financed. We need more money in both the House and the Senate sides. The President's put some, I think, constructive ideas forward. They've been difficult. At some point, we're going to have to act like adults and say that this is going to require revenues, and each of us is going to need to make a contribution. I've been very disappointed so far in the effort to hide the revenues. We are unique in the Western world in not having an explicit dedicated tax that goes to healthcare. So financing is going to be, I think, the principal challenge and the trade-off going forward. The second one, of course, is how do we change health delivery to get better value for a dollar? How can we attack some of the chronic challenges in a system that today is based on acute care? How can we take advantage of many of the advances in the states and localities and systems, Geisinger, Mayo, that truly show us what coordinated person-centered care can do? My test of reform is how much we put in place that moves the system in that direction. And the third challenge is political. We have, in my mind, a incremental proposal, especially on the Senate side, that's consistent with long-held Republican views, and yet Republicans aren't supporting it. I regret that. I think that's a short-term calculation that the party will end up regretting. We've had very positive leadership in the past from Governor Romney, from Governor Schwarzenegger, from Tommy Thompson and others. This should be bipartisan, based on the merits, based on what the policies are. So I'm hoping that people will see the light as we go forward, but I think that's a big challenge, not only in terms of the vote this fall, but also in terms of going forward. We need to have a broad base of political support for what's likely to be a multi-year effort to do better in our healthcare system.